everybody to the EOC, the Emergency Operations Center. This is where our state government operates out of during emergencies. Traditionally, of course, in recent history, fires and floods. The Great Flood of 2013 has been managed thanks to the hardworking folks here at the Emergency Operations Center. Today, we're dealing with a crisis of a different kind, a public health crisis, a virus, something that threatens all of us here in Colorado. And we want to act accordingly, boldly, and quickly to do what we can to reduce the contagion and ensure our economic recovery. I'm joined here by Matt Blumberg, our interim leader of the COVID Innovation Response Team, Sarah Thunberg, the incoming leader of the COVID Innovation Response Team, Casey Wolf, Chief of Staff for the COVID Innovation Response Team, Kyle Brown, the testing lead for the Innovation Response Team, Gretchen Hammer, the isolation support leader for the Innovation Response Team, and Noel Ginsberg, Chairman and CEO of Intertech Medical. I'll be talking about why this is so important shortly and a bit about what they're doing as well. But first, an update and the additional actions that we will be taking. Today, we have 591 positive cases in Colorado. To be clear, that's the number of tests that have converted positive. We fully expect that the number of Coloradans who have COVID-19 is in the thousands. So only a fraction of that have been identified. And if you are exhibiting symptoms, you are to self-isolate in your home. You don't have an urgent need to seek out testing on an emergency basis. Whether you have the flu or COVID-19, self-isolate. And if you need medical attention, please seek that medical attention. Around 8 or 9 in 10 people who have COVID-19 do not need additional medical attention. If you do, seek it out. If you don't, self-isolate immediately. For the 591 cases, 58 people are hospitalized in our state from COVID-19. We've had 6 tragic deaths in our state of Colorado, and currently the identified positive cases have reached 29 counties. We fully expect that it will reach all 64 counties. We've tested over 5,000 Coloradans to date. This testing, which we are ramping up and we'll talk more about later, is giving us key intelligence and data that we are using to coordinate our response. As you know, this situation grows more serious by the day. Here in Colorado, across the United States, and indeed across Europe and much of the world. Scientists and public health experts all are making us gravely aware of the choice that we have and the choices that we need to make to save lives, as well as preserve the livelihood of Coloradans to put food on the table. If we do not do more to slow the spread of the virus, our healthcare system will be overwhelmed, and doctors simply won't be able to treat every patient who needs it that they could otherwise save, given the ability and the equipment to do so. Therefore, we could be forced into a wartime triage situation, having to choose who gets a ventilator or a bed and who doesn't, who lives and who doesn't. That's what's going on in Italy today, and why we need urgent action, individual actions, county actions, and state actions. It's why you only need to shop for groceries once a week and not go out with friends. It's why we all need to increase the physical distance between ourselves and others. The most valuable resource we have is time, and we need to create more of it by slowing down the spread of the virus in Colorado. Time that we can build our healthcare capacity, build beds, secure more personal protective equipment, more ventilators, more life-saving equipment, and better deploy those resources. That has been our challenge and our goal from the very beginning. You know, I ran for governor on a platform of kindergarten for all and lowering healthcare costs and growing our renewable energy economy. I never imagined the severity of these choices that my team and I would have to make over the past few weeks and increasingly in the coming weeks and months. And in many ways, I couldn't have imagined that our nation's response could have been so slow. Like many governors of both parties across the country, I'm furious that as a leader of the free world, we're being forced to close down businesses and restaurants and bars because the United States, unlike South Korea, unlike Taiwan, didn't have enough tests, enough personal protection equipment or ventilators to properly manage care for those who would get this virus. But we're not dwelling on the failures of the past. We're talking about the path forward for the future. Our medical professionals tell me at the height of the virus in Colorado, we might need 7,000 more ventilators than we have today. The administration told us as much when he said the governors were essentially on our own to get medical equipment. Try getting it yourselves was the quote. So based on these developments, it's clear to me and my administration that, like all governors across the country, we as states need to play an unprecedented role in securing our own supply chains of personal protective equipment and ventilators to deal with the virus, and we are, and we will. We need to implement even more dire restrictions to slow the spread of the virus. In past crises, national disasters, pandemics, Americans have looked to our national government to step up. And to be sure, the hardworking men and women of our federal partners, the FEMA region, the state EOC, the U.S. Army Corps of Engineers, the Center for Disease Control and Prevention are working side by side by our teams and are setting up to work in great collaboration. I've also requested the President approve special funding for our National Guard so we can more fully use our Colorado Guardsmen and a dual status commander that we can integrate into our active Army partners. I've also stated that governors will continue to play an unprecedented role in our response. We are rising to the occasion. We are bringing in the expertise we need to scale our response and leveraging our relationship with elected leaders across the state as well as private industry partners. I want to be clear that our efforts at the state level are robustly bipartisan. Both Republicans and Democrats in our federal delegation have been all hands on deck to support Coloradans. Senator Cory Gardner, who I talk with multiple times every day, has done everything I've asked to help in our response. Our big city mayors, Mayor Hancock, Mayor Coffin, Mayor Suthers, and all mayors, county commissioners, and county health departments. Leaders from all over the geographic map and all over the political map have been equally engaged and supportive of Colorado's response. Legislators from both parties at the state level have launched into action to support Colorado's response, and from the bottom of my heart, I thank them, just as we wish Representative Michelson Janae a speedy recovery from COVID-19. I deeply appreciate this collaboration from the private sector, from members of both parties and no party, from nonprofits, from workers in grocery stores to healthcare workers. Seeing large acts, good acts, large and small, and hashtag doing my part CO really gives me hope about the ingenuity and resilience of the people of Colorado. Today, I'm announcing an executive order for all non-critical workplaces to reduce in-person workforces temporarily by 50%. And if you can do it, by more than 50% through telecommuting, through shifting and staggering of schedules. If workplaces can convert to 100% telecommuting, I encourage them to do that. The order directs Colorado employers to implement telework capabilities to the greatest extent possible. When telework is not practical or possible, employers should stagger work schedules to reduce the physical proximity of people doing work and keep employees on payroll as we endure this temporary disruption to our economy together. This executive order doesn't apply to employers that can certify that employees are no closer than 6 feet during any part of the workday, or workers in the critical workplaces that are essential for our emergency response. And that means healthcare operations, critical infrastructure, critical manufacturing, critical retail, critical services, news media, financial institutions, provider of necessities to the economically disadvantaged, construction, defense, public safety, vendors to the public sector and critical services and critical government functions. There will be a detailed public health order that details these today. I want to be clear, for those who are in those critical sectors, we really want to encourage those employers to step up and still make sure that at least 50% of their workforce can telecommute or as a staggered schedule. So no more than 50% is physically working there at the same time. The order affects those who are not in those critical sectors. We are one of those. That is the state. We are actually one of the critical ones, and we are going to lead by example. As an employer of over 30,000 Coloradans, starting tomorrow, we're going to have more than 50% of our non-24-hour employees working from home. Now, what does that mean? We have, by nature of their position, our dedicated prison guards, those who monitor at our youth detention facilities, that have to remain on work on the normal schedule. But for the other functions of state government, we will be modeling by example that even in a critical sector, we will have a majority of our workforce that is telecommuting and not in the buildings at the same time. This allows for greater physical proximity in the workplace. Just as a temporary closure of bars, of restaurants, of salons increases physical distancing, this will help workplaces increase physical distancing so that workers who are critical are at least 6 feet apart to the extent possible. And I want to thank the employees who during these difficult times are, of course, still coming to work to ensure that people have access to Medicaid and SNAP, staffing the state mental hospital, our correction facilities. Truly, those who work every day in our critical industries are heroes, and I want to commend you for your sacrifice on behalf of the people of this state. The executive order that will be pending and issued today also contains more guidance for how we can increase our physical distance from one another and succeed in containing the spread of this virus. Coloradans are encouraged to stay home unless you are obtaining necessary services or supplies, delivering those services and supplies to people who need them, going to or from work, engaging in outdoor recreational activities where you can maintain at least a 6-foot distance from others, or of course caring for a family member, a vulnerable person, a pet in another household, or livestock. And I want to encourage Coloradans that when you're doing those limited activities outside of your home, try to do them as infrequently as possible. Shop once a week for groceries instead of twice. If you're accustomed to jogging 3 or 4 times a week, jog once or twice a week. Try jogging in a different hour when less people are out. If you're a 7 in the morning jogger, wake up early and go at 5. Go a little bit less so that those who are able to can increase our social distance. When you go out once a week to get groceries instead of twice, it will limit your exposure, our exposure, and save lives. Maybe your uncles and aunts, maybe your parents, maybe yours. And if you are at high risk, we advise you not to leave your house for those reasons. People at high risk of severe illness from COVID-19, that could be somebody of any age who has respiratory issues, or somebody who's in their 70s and 80s, or who is sick. You're urged to stay in your residence to the greatest extent possible, unless you need medical care. And I hope that if you know somebody in that category, for your 76-year-old neighbor, please call them and ask, can I pick up groceries for you and leave them at your doorstep? Can I walk your dog? Ask those things because we want to help all those who are most vulnerable avoid exposure to this virus. And if you're experiencing symptoms of COVID-19, if you are experiencing symptoms of illness or have a fever, self-isolate until several days after your symptoms cease or until you have a confirmed negative test result. This is a time where we all need to do our part to protect Coloradans. You know, people have asked, how are you going to enforce this kind of behavior? There is no enforcement authority here. There is a far greater enforcement authority in these matters, and his name is the Grim Reaper. If we don't abide by these simple common sense protocols, you will be jeopardizing lives. It could be your friends, those you love most. It could be your own. But that is the ultimate enforcement of ensuring that we all are doing our individual best to make sure that we have that physical distancing with others to immediately contain the contagion of this virus. And I want to thank all of you who are stepping up already. The hashtag Doing My Part CO social media challenge, those who have donated to the COVID Relief Fund over $4 million, those who have signed up to volunteer at helpcoloradonow.org, and those who have stepped up to donate blood. I have another ask for you today to keep our healthcare workforce, those on the front lines, from getting sick. Because we receive so little from the national stockpile, we need Coloradans to donate any personal protective equipment, masks, gown, gloves to this effort, if possible. You can donate it to your local health department or to the state. And we're seeing a huge outpouring of support. I want to acknowledge this. In the response to this personal protection equipment drive, there was a bipartisan effort led by House Majority Leader Garnett and Minority Leader Patrick Neville, with many members of the state legislature, Project Cure, Colorado Concern, the Denver Broncos, with a drop-off point for personal protective equipment. Thousands of cars came through today to donate that equipment. We've, as a nation, done this before. In world wars, Americans donated scrap metal to defeat the enemy. They had meatless Mondays and wheatless Wednesdays to save food for our troops. That's the spirit that we need to combat this public health crisis and save lives. Creating physical space between you and your others is critical. It's also important to maintain those emotional connections and step up where we can. We also were able to, as an example, waive a regular rule at the Colorado Department of Agriculture that requires in-home visitation for pet fostering to allow anybody to do pet fostering during this crisis. If you can foster some pets, call your local humane society, call your local animal shelter, and express a willingness to do so in this crisis. Animals, pets, your dogs, your cats, they do not spread the virus, to be clear. And creating that physical space between people is important. It's also important to maintain emotional connections with those who are important to you. That means using FaceTime, using video chat. If you have kids, getting on a Google chat and having them talk to their friends. We all need that fellowship now. Spiritual fellowship and social fellowship. We're in this for the long term. Some steps are immediate and urgent and shorter. Other steps will have to be maintained over time. Because without rapid action, the scientists and healthcare professionals who've presented to me say that this crisis could last many months, could last over a year. Now, that's unacceptable, and therefore we know that we cannot expect what's going on tomorrow and next week in terms of distancing to be our new normal. We need to get back to a place where we can enjoy the things that make life worth living. These immediate steps, this social distancing and the way that we're doing this cannot last forever, and we know that. Now, I personally won't stop until we solve these problems. These problems like lack of testing and lack of healthcare capacity. We'll be entrepreneurial and innovative and relentless in our pursuit to change the trajectory of this virus. That's why even in the middle of this crisis, as we're acquiring personal protection equipment, as we're implementing these physical distancing measures, as we've temporarily closed our bars and restaurants and salons and make sure that businesses that are non-critical only have up to half the workforce that are on site, we also are standing up a new division in our Emergency Operations Center to help us innovate our way out of this quagmire that the lack of a coordinated national response has created. We're going to innovate our way to a sustainable, longer-term response. Today, I'm establishing the Innovation Response Team Task Force, which is tasked with several clear objectives. One, developing a statewide system for mass testing and rapid results. Two, developing mobile and other technologies to track the spread of the virus and support those at risk and infected citizens. Third, creating a suite of services for citizens under isolation or quarantine. We know that it is hard. It's hard emotionally, it's hard socially, particularly for the majority of the people who contract this virus who will have minor symptoms. It's hard to remain out of circulation so long. We want to create that suite of services. It might mean something as simple as you need food brought to you so you don't go out. It also might mean that you need Wi-Fi or internet or a way to be productive and contribute during that difficult time. We're going to create, as part of the state response team, a way to maximize compliance with that kind of isolation. And finally, develop locally sourced alternatives that allow us to secure and scale the manufacturing of critical medical supplies to keep our frontline workers safe, our healthcare workers, our grocery workers, and others. These are the priorities of our Innovation Response Team Task Force, which will complement the ordinary work of the EOC in the crisis. This Innovation Task Force is being led on an interim basis by Matt Blomberg, a technology entrepreneur who founded and led Broomfield-based email technology company ReturnPath for 20 years. Sarah Thunberg of GeoSpiza, a company that deals with risk assessment, who will be working with the team and eventually will be the leader of the team. The chief of staff for the innovation team will be Casey Wolf, a senior healthcare policy advisor in the governor's office. Kyle Brown, who works at the Division of Insurance normally, is also a city councilman, will lead our testing team. And Gretchen Hammer will lead our isolation support team. We need all of these functioning together to be able to show that in Colorado, we can successfully respond, as nations have, like South Korea and Taiwan, and have returned to normalcy sooner and reduced the loss of life that have occurred in areas without this kind of coordinated response.
An important component of the innovations team's work is private sector partnerships, which is why I'm appointing Boulder-based venture capitalist Brad Feld as chairman of the Innovation Response Team Private Sector Task Force. Brad has kindly volunteered to spend as much as needed time as necessary to help manage this crisis for Colorado and share that information nationally and globally. Brad will coordinate the corporate and private sector volunteer activities. I understand there's hundreds of volunteers that have stepped up in specific areas: manufacturing, telemedicine, at-home service delivery, tracking. I want to thank as well my friend Noel Ginsberg, who's here. I come out of the tech industry, as many of you know. I've never manufactured anything. Noel manufactures stuff for a living and has worked with manufacturers. He stepped in to help by using his entire network and his companies to start manufacturing personal protective equipment right here in Colorado to keep our healthcare workers, our grocery workers, and all of us safe and to save lives. He's already marshaled 25 academic, business, and industrial leaders that are meeting on a daily basis to attract critical supply chain purchasing needs for our state and standing up personal protection equipment manufacturing that's sustainable here, as well as uniting those supply chains across the world. For example, hand sanitizer, manufactured by Aura Labs with Colorado workers, will be available to first responders and hospitals starting this week. Genesis Plastics in Greeley is gearing up to manufacture plastic face shields. These have a 3D printed technology, open source piece. We're working with 3D printers across the state, and people can do this on a distributed basis. And the manufacturing of the screen part is being rapidly scaled up as we speak in Greeley. Intertech Medical is a manufacturing company making test kits for BioFire that can diagnose the virus within 45 minutes. To have a return to economic productivity for people to put food on the table, to contain the spread of the virus in the medium and long term beyond these short-term steps, which we know are not sustainable, but we have to do. We know that we need to scale up that testing to have that rapid response as well as the isolation services. This is the sort of patriotic response that we need across the public and private sector for Colorado to mount a response to this virus that saves lives. This is Colorado in our toughest days, but it is also Colorado at our best, rising to the occasion to offer what we can do to save the lives of our fellow citizens. If you're a private sector company who has the capability and wants to partner with this team on acquiring or testing or critical constrained medical supplies or technology, sign up at helpcoloradonow.org. There's a section to sign up for individuals who want to volunteer, to donate money to the relief effort, but also for the innovation team, for companies that want to coordinate with our innovation team at the state level. If you have something to offer, these calls have been coming in all different ways, some even through members of the press corps. We now have an organized way for that to occur. Go to helpcoloradonow.org and fill that out. We will have controls in place to ensure that the quality of the equipment and the tests meets the levels of protection that we owe to the people of Colorado, especially for our healthcare workers. And we are working with speed, we are working with urgency, because we know that we are dealing with human lives. We need to do it fast, and we need to do it right. We know other countries have fared better than the United States on being prepared to combat this virus. They've done it through mass testing and isolating those who test positive versus quarantining a whole society, which is unsustainable for a period of time. We're asking people to stay at home now. We're asking, of course, those who are most vulnerable from staying home for any reason except seeking medical treatment. But we know that that is a difficult ask for all of you. And we know that we need to return to as normal a functioning society as we can, as quickly as we can. And that's why we're gearing up our mass testing strategy, so that rather than with a mallet, we act with a finely tuned quarantine on those who have the virus and those who have been exposed to them. Our mass testing strategy relies on the most clinically relevant tests. There's at least two ways to test for COVID-19. One method, known as RT-PCR, tests for the presence of the virus using a nose swab. The other, known as serological tests, test for the body's response to the virus, often with a prick of blood. RT-PCR tests can tell if a person is infected sooner than serological tests, making it more relevant for clinical decision-making, diagnosis, and isolation. There's also proxies. for detecting for the virus. When we entered this building, all of us, including myself, everybody here, members of the press corps, your temperature was taken. I hope your temperature was taken. Was your temperature taken? Everybody here. I'm not exempt for that. That is a proxy, because if you have fever, you are contagious. So that doesn't catch at all. Some people are asymptomatic, but we can severely reduce the spread of the virus by implementing those measures, and we have implemented them here, and we will be looking at a larger scale implementation of that, as well as the testing for the virus. Our teams, including the innovation team behind me, are working hard at procuring and coordinating deployment of both kinds of tests, as well as protective equipment and thermometers. We'll continue to partner with the federal government, of course, to get Colorado's fair share of relief, but it's become clear to us that that won't meet our entire need. I'm grateful for the hardworking men and women from the Army Corps of Engineers that arrived this weekend and are deployed to help support our healthcare capacity surge, building, and planning. I'm grateful that the hardworking men and women at FEMA are on top of the job and working with our operations center. But as I've stated before, the states will be taking on an unprecedented burden in changing our paradigm, that if we're going to avoid a catastrophic breach of our healthcare system and prevent long-standing economic damage to the state, perhaps including your job, we need to act boldly, swiftly, and immediately, and we are. As you've probably read, projections show that our national response has failed to act early enough, and this virus is likely to be with us for many months. My goal is to ensure that these extreme social distancing measures, this physical distancing of up to 6 feet, will not have to be there for the many months that we have this virus. We're going to do everything that we possible to make sure that we're doing that, but your part is the biggest. It is abiding by these physical and social distancing techniques. It is your decision to only shop for groceries once a month instead of twice. It is your decision to go jogging twice a week instead of 4 times a week. It is your decision to simply get in your car and go to work and return. It's your decision not to meet with a bunch of friends or have parties or socialize or go out for this limited period of time. Because the life you save could be your grandmother's or grandfather's, your mother's or father's, your aunts or uncles, and it could be yours. This is not an ideal response. In the short term, Colorado's need to heed this advice and take this situation as gravely and as seriously as healthcare leaders are. But my team is moving as fast as we can to build a Colorado paradigm to ensure that we can look more like South Korea or Taiwan's successful containment strategy and less like the deadly and devastating public health disaster that's crippling Italy right now. And if you haven't seen that, I don't want you to spend hours doting on that and worrying, but Google Italy, coronavirus, hundreds of deaths every day, people that are being triaged in a way where there's simply not enough treatment to save lives. We have to avoid that. We have to physically distance from one another during this time as we gear up towards creating a society that can get as close to normal as possible and can target positive test results with a targeted response rather than this broad guidance across everybody. But right now, we simply don't have the luxury not to ask. The ideal response would have been to have mass testing in place months ago to spot infected people and quarantine them for 14 days, rather than effectively what we're talking about here, which is moving towards quarantine an entire society, reducing the number of contacts that everybody has. But we don't have that luxury. We are where we are. The virus is here in our communities, and we must respond accordingly, and we are doing just that. As long as I'm in this position to lead Colorado's response, I'll continue to take bold steps and do everything in my power to protect our medical workers, limit the severity of the crisis, and save the lives of Coloradans. This is so important that we all take our individual and collective actions to change the trajectory of the spread of this virus in Colorado. I know it's hard. The state runs a lot of different things. We have over 30,000 people. We are going to less than half of the people that aren't in our 24-hour facilities that will be coming to work on Monday. By Tuesday, we expect the private sector, those who are not in critical industries, to be able to get there in our state. So you have better spacing at the workplace, which might mean every third cubicle instead of every cubicle. It might mean there's 2 shifts with people coming in at different times. It might mean that everybody's telecommuting. We would love anybody that can get to 80, 90% telecommuting. Please do that. from your HR department, your executives, your small companies. Figure out the best way to do that. It's absolutely critical to do that as much as possible. The same for those in our critical industries. We cannot miss one step in our response in the sectors that are needed. However, we all should think critically about how we can still increase distancing even in those critical sectors. And I want everybody to operationalize and think about how we can best do that for the days and weeks ahead, till we have the scaling of the testing, till we have the isolation protocols, till we have a way in place where we can have a targeted response to this with much more minimal disruptions to our everyday lives, to our jobs, and to our economic activity. That's the goal with the team we're announcing today. That's where we expect to get as a state. In the meantime, please alter your personal activities in a way that reduce your encounters with other people and increase the physical distance for those encounters. Thank you, and I'll be happy to take questions. We'll alternate between in-person questions and telephonic questions. We'll begin with a telephonic question. We'll begin with an in-person question while they're queuing up. Go ahead.
Question. Thanks for your candidness. We've gotten phone calls from viewers, some who sound ill, some sound scared because their doctors are telling them don't come in. They don't have tests. Hospitals are telling them the same thing. We got one call from a single mom of 3 who sounds like she's getting worse and feels like no one will help her.
Yeah. Well, if you need medical care, seek medical care. That is clear. Again, 8 or 9 out of 10 people will not need any additional medical treatment. You will recover in home like you do for the flu. And by the way, that person might have the flu, they might have COVID, they might have strep. I mean, it depends on their symptoms and their clinical diagnoses. They could have anything. But if you need medical care, you get it, right? You call for medical care. If you don't need medical care, if you have a cold or flu, stay out of circulation, right? Avoid encountering others. Have your neighbors, those who are your friends, bring your groceries to your doorstep and leave them. Whatever, and again, I hope that those of you are contacting people in your neighborhood in this situation. We don't want to put it upon the person who's sick to do that. If you know a loved one or friend is sick, call them. Just say, what can I do? Can I bring some groceries to your doorstep? Can I, how can I help? Don't panic. Don't worry. This is a lot worse than the regular flu, but there are people that are hospitalized with the flu every year too. And the guidance is the same. If you don't need medical intervention, you isolate, stay at home, and 9 out of 10 chances you'll recover without any medical intervention. If you do need medical assistance, please call, and you will be tested when you're admitted to that facility because they need to know how to isolate you or not. Those tests are sufficient for the clinical need now. They're simply not sufficient for the mass testing need that we need to be able to implement to be able to reduce these very difficult measures that we're asking of people, which are to keep that physical distance, that social distance.